Hello everyone, welcome to the event today. Welcome to Let's Talk About Gender. So the format of the day, we'll have each speaker introduce themselves, and then we'll go for questions for about an hour. Now I'll go through the panelists, and then from the chat in YouTube, if you want at any time to type a question for any of our panelists, you can do that, and it will be fed back to me. And then for the last 20 minutes, half an hour, we'll take questions in from that chat. And then sadly at 8 o'clock, we'll be finished. So we'll go through and speakers can introduce themselves. Tara, would you like to go first?
Hi everybody, I'm Tara Hewitt. I'm a leadership and inclusion consultant. I work as a senior manager in equality and diversity within the NHS and also across different organisations in a consultancy capacity. I'm the co-founder of the Trans Equality Legal Initiative, which works with human rights lawyers, barristers, solicitors, trans activists, diversity professionals and campaigners to try and bring a real evidence base to the discussions around trans rights within the UK and make sure that trans people have access to appropriate legal representation by signposting to fantastic lawyers that want to represent and work with them. I'm also one of the co-founders of the Trans Staff Network within the NHS, which has brought together 120 trans colleagues working at NHS trusts across the country to provide peer-to-peer support. I have a history of activism, starting off at university, campaigning against fascism and the BNP, standing up for human rights for all communities, and making sure that people's voices can be heard, particularly when the state and society doesn't want to hear them. So I'm here to share some positive sparkles where I can, but also help empower people to speak up against some of the challenges trans people are facing in society right now.
Thank you for that, Tara. Jennie, would you like to go next?
Right. Hi, I'm Jennie Kermode. I'm an author and journalist. I was chair of Transmedia Watch until fairly recently. I still work there. I'm also a member of the Equality Network and the Scottish Intersex Forum, and I've done a huge range of different kinds of equalities work over the past 35 years or so. So lots to draw on.
Thank you, Jennie. And Thanel, would you like to, last but not least?
Hi, yeah, so I'm Dorian. I'm the founder of the Trans Rights Collective UK, which is a little amateur group of sort of passionate, unpaid, enthusiastic trans and queer folk that we got together when we started up a protest last July in response to the leaked proposition of plans to scrap the Gender Recognition Act reform. And now we've kind of made that into a little bit of an official group where we continue arranging and organising protests, liaising with other organisations, and just sort of generally using our platform to elevate people and see where we go from there.
Thank you, Thanel. And I am Catherine. I am the policy officer for LGBTIQA Greens, and I do lots of other stuff in the Green Party as well. So we'll go straight into questions. So first of all, I'm sure we're all disappointed about the trans rights protest being called off at the beginning of this month. Thanel, could you tell us a bit more about what happened there?
Yeah, so we had everything lined up. We tried to avoid too much direct collaboration with the police, but we sort of followed legal protocol and had it confirmed from them that we had the space, which is Parliament Square, because it's nice and accessible. And everything was going fine and smoothly after the success of our protest in July. And then the day before the protest, we unfortunately received a phone call informing us that there was a great likelihood that organisers, attendees, BSL interpreters would be arrested and fined £10,000. So we unfortunately had to make the very difficult choice to cancel the protest. We liaised with Polish Rainbow, who are going to have a march that would be ending at the protest. And unfortunately, we thought it would be safer for everyone involved, knowing how dangerous it could be for marginalised groups when it comes to police interaction and arrest, to cancel it, which was a very sad decision. But I think ultimately safety came first.
Yeah, it's very disappointing. I was supposed to be at that protest as well, which I'm sure some of the people in the audience were as well. Tao, did you have any thoughts on the cancellations and the police actions on this?
I think it's just reflective of what we've seen throughout the current climate in response to actually all of the responses to COVID-19. We've seen wrongful convictions, we've seen actually misinterpretations of the law, we've seen lack of clarity on what should and shouldn't be happening. And as always, trans people and minority groups tend to get the heavy-handed and most negative approach and response. I think safety needs to come first, and actually making sure that both public health and safety from any possible impacts of police action on trans activists. But we saw in Manchester at Pride last year, the police refusing to stop anti-trans protesters acting in a way which many of us felt was in breach of the law. So the police are quite quick to respond when it's trans people trying to speak up for their rights, but when it comes to people that are trying to push us back and take away our human rights, that they're unfortunately not always there. So yeah, safety is important, but I think it's just a reflection of where we are at the moment, where human rights aren't being prioritised in this country.
Yeah, absolutely. I completely agree with that. And Jennie, did you have any thoughts around this issue?
I would just say that I think it is really important at the moment to put safety first, because this isn't just about the people who choose to go on any given demonstration. It's also about the people they come into contact with when they get back home. And, you know, there are also some particular issues that trans people face which can put them at greater risk with this kind of pandemic. As we've seen, you know, people who have trans people are more likely to have existing health problems because often people find it harder to approach doctors and so on. Trans people are more likely to be poor, which means they're more likely to end up in the kind of workplaces where they're forced to work despite the situation. There are lots of issues like that we have to deal with as a community. So I think it's important to be safe. I also think that for me personally, I've been ill for a number of years to the point where I haven't been able to go on any kind of protest, although I did a lot of that when I was younger. What that did for me was it persuaded me that I needed to find other ways of doing effective work to campaign against problems. I think that protests can be a little bit like signing petitions. They're both very useful, but if they're the only thing that people do, then they only get you so far. And I hope that the current situation will actually encourage people to think about other ways that they can make their voices heard, other useful actions they can take that might actually make more of a difference in the long term.
Yeah, that's very, very good points. So I'll go on to the next question. Where was I? So Thanel, I'll ask you this first as well. What would you like to see incorporated in the Gender Recognition Act? And do you think pushing for a reform should be a priority for the community?
So I think we published a list of demands when it came to the Gender Recognition Act, and I think a lot of the core things are things that have already proven to work in other countries. So I would say the priorities with the Gender Recognition Act and what we require for a reform of it is self-ID, which has been proven to work in Ireland without any kind of problem. You can use like solicitor self-declarations, which I think the concept of self-ID with a little bit less vigorous gatekeeping would be good, because a lot of the problem with the current process is that it feels quite outdated and there's a lack of accessible information. People have to go through a panel where there isn't much transparency on who the panel are and exactly what they do. There's some very uneven gatekeeping as well, where, for example, you don't need to have certain surgeries in order to have a gender recognition certificate at the moment. However, if you have had surgery, you have to provide vast amounts of evidence of that surgery. And if you don't have enough, you may be rejected, despite the fact that it's not even a requirement in the first place. I think another big thing is more recognition of non-binary identities. We've had that wonderful news recently that non-binary is definitely included in the Equality Act under like the gender reassignment thing for trans people, which is great. So I think another wonderful step forward would be to actually recognise non-binary people and allow them to have more recognised titles and have like a third gender marker option. Thankfully, we don't have too much identification in the UK that requires a gender marker, but it is still something that is on certain documentation, and it would be much nicer for non-binary people to have more legal recognition under the trans umbrella. In terms of whether it's a big priority to push for it at the moment, I want to give a very grey yes and no. It's something that we pushed for because of the news that came about. It seemed like a very important thing to focus on. But I think it's very important to recognise that you can focus on more than one issue, because there's a lot happening with other marginalised groups at the moment, and marginalisation within the trans community itself that sometimes needs to take precedent. There isn't always accessibility for trans people, and a lot of black and brown and people of colour trans people don't get the same equality and ability to platform that white trans people do. So yes, the GRA is important, and I think that's something that needs to be acknowledged by the current government, but it's not necessarily the most important thing to focus on all the time.
Yeah, I totally agree with that. Like, intersectionality in the community is really important. Jennie, would you like to have a go at this question as well?
I will just start by saying that there is one really huge problem with the Gender Recognition Act at the moment that's often overlooked, and that's that if you don't have a diagnosis of gender dysphoria, you cannot legally change your gender that way. Now, this means that if you're intersex and you're unable to be diagnosed with gender dysphoria as a result of that, you can't use it. You're stuck with the gender that you've been given. I have friends who have had their gender legally changed in records by doctors 3 times during their childhood, who are not able to change it themselves as adults. It's a ridiculous situation, and frankly I think that you don't need to be particularly well apprised about trans issues. You don't need to be part of any particular group around that to understand that this is something, you know, that is really obviously wrong and that we need to do something about. I concur that the lack of non-binary recognition is a serious problem. That's something that's starting to change elsewhere around the world, and I hope that that will change here in due course. There is one other issue that continually comes up with this in conversation with the Gender Recognition Act, and that's something I think, again, that the general public is not aware of, but the most people, once they hear about it, think of very seriously and do it. They understand then why we have so many concerns, and that's that if you are turned down for gender recognition, you can't appeal. And the idea that a panel of people who you probably never meet, who don't know much about you as a person, can decide, no, you're never going to be allowed to have your gender recognized and respected formally, it's a ridiculous situation, and there's nowhere that you can turn. I mean, people's own doctors can support them, they can be supported at work, everybody they know can recognize them in the gender that they're living in, but they can find that they're just stuck because of this kind of bureaucratic obstacle, and that needs to change. I think that there has been a lot of hype around the Gender Recognition Act because we've seen some people who are frankly hostile to any kind of trans rights pressing on that, trying to make it sound like something that it's not. It's a bureaucratic issue, but it's an incredibly difficult one for people to deal with, and we need reform so that people can just get on with their lives.
Yeah, absolutely. We shouldn't have a panel of people we've never met deciding who we are.
Mm-hmm.
Tara, would you like to?
Yeah, I'd echo everything that has been said. I think that all of those areas absolutely need to be covered, and I think that state recognition is a fundamental principle in terms of the state should recognise who I am, and it's not for the state to tell me who I am, it's for me to tell the state who I am. And I think at the moment that balance is offset, and this idea that you have to go and almost beg for somebody to allow you to live your life as yourself and the state to view in that way is degrading, and I think that for me, that the fundamental principle that you have an anonymous panel judging on evidence gender has never been right, but it absolutely isn't right when we've seen around the world self-ID and other processes working effectively. And I think the government just needs to live up to its own promises and pledges. The government says it wants to be a leader on human rights, then it needs to lead on human rights. And at the moment, if you look at any of the fundamental markers, there was a recent report from the European, I think it was the European Commission, but in Europe, looking at trans rights across Europe, and actually this country has fallen behind in terms of legal recognition and what's expected compared to a whole host of other countries across the European Union. I think as well it's recognising that the Gender Recognition Act isn't enough. Actually, they're almost making us want to beg to get the Gender Recognition Act changed and be grateful that they don't make it worse. And I think we need to start demand that we want more than the Gender Recognition Act. Actually, we want an end to systematic discrimination. We want an end to people being scared to go and see a doctor. We want an end to people actually seeing institutional transphobia on our state broadcaster. We want an end to people not seeing anybody opportunities for career progression and trans people facing barriers into the workplace. We want an end to trans people more at risk of homelessness. I could go on. But the government made a pledge that over 30 recommendations that came out of the inquiry into trans equality in the UK in 2016, led by the Parliamentary Select Committee into Women and Equalities, that over 30 recommendations were made, and the government responded to say that they would deliver most of them. I'm yet to see significant change across most of those 30 actions. And so I feel the government just needs to start to live up to their promises. I know that's a famous quip with politicians that they never live up to their promises, but I think it's time we held them to account and actually said that enough is enough and we want to see what they've promised us.
Yeah, absolutely. I haven't seen any of the major recommendations from that we brought forward with the government, so we definitely need to hold them to account. Next, why are gender diverse people so underrepresented in all aspects of society, and what can we do to address this? Tara, as you do a lot of work in workplace equality, would you like to take on this one first?
Of course, I think we need to start looking at our history, and I think for me, a lot of the positions in society are generational. They rely on actually a time span for you to be able to reach certain roles. And if we go back into history and look at the barriers for trans people to be recognised pre the Gender Recognition Act being in place, even in its current form, pre some of the protections that existed prior to the Equality Act and prior to some of the earlier discrimination provisions, actually people were facing significant barriers to be able to access healthcare and transition in society. That doesn't mean that there wasn't some fantastic role models throughout our history that we can celebrate and talk about, but actually it often led around people having the economic opportunity to be able to come out and transition in the background of a world where it wasn't necessarily as understanding and as accepting as it should be. Also, we can go back and even look at the progress that was pulled away in parts of Europe with the rise of Nazi Germany, burning all of the research and attacking the trans community as part of the rise of fascism, and that not necessarily being really talked about or discussed or rebuilt after the Second World War. And so actually there's some of our history that we really need to start looking at if we want to see why we are where we are today and the fear that comes out of that. We then look at the structural barriers in inequality that our society build in. So everything is built around the gender binary in any way, shape or form, whether that comes to you logging on to ask for your bins to be changed, to actually starting a bank account, having a GP, registering at a GP, actually logging onto a Facebook when Facebook first started until they decided they'd have different gender options. And so our entire society is built around this historic idea of what the gender binary is. I think we we don't talk enough about the harm society causes on trans people in terms of how that is a knock-on effect in the workplace. So if I, for example, and I'm sorry for triggering some people, but just in terms of, so a warning around mental health, but an example of some of the experiences I've had in abuse before work, I've had people send me horrendous threats, telling me to hurt myself or kill myself or things which are vile, and I won't go into any more graphic detail than that. But I'm then still expected to go and do my job. I'm expected to go and manage a team of people. I'm expected to go and do whatever my job is. And whatever task or role that I'm in. And that can't but have an impact on my ability to do that role. The energy that I'm going to take away from opportunities that I might seek at work, being able to apply for jobs outside of work and a career advancement, taken away because I'm having to build my own resilience around that. Other issues that we don't discuss are the generational differences. So the fact that if people were transitioning later in life, historically, because of some of the barriers we've discussed, that actually that led to different challenges in terms of where people were economically or positionally within organisations. Whereas today we're seeing people often transitioning a lot younger, in terms of people spending their whole careers out as trans, and that leading to barriers at every stage of that person's career in being able to advance because of the transphobia that we see in wider society. I think we often conflate involvement with expertise, and actually the need that just because I'm trans doesn't mean I understand the experiences of trans people of colour, trans people who are wheelchair users, trans people that have learning disabilities, trans people in the law. Actually, unless I've had training and background in trans people in the law, I'm not going to know about that. Unless I am a trans person of colour, I'm not going to be able to share that experience. And I think historically, people have found a trans person, and I've had people contact me and say, Tara, often in the news, actually BBC Northern Ireland's really good at this. I'll often get requests to come and talk about sports. So Tara, can you come and talk about trans people in rugby or trans people in athletics? And literally my response is, I eat cake. You don't want me to come and talk about trans people in rugby? Get some people that play rugby or some people that are athletes if you want lived experience. If you want me to come and talk about the law, or you want me to come and talk about workplace rights or trans healthcare, I can come and do that. But again, I think historically we've conflated involvement with experience. I think that some of the challenges are that we thought that good intentions were enough with initiatives, and we've allowed a lot of rainbow washing. We've allowed LGBT as an acronym to talk about trans involvement. So people have said they've done LGBT work, but it's never included trans people. And then we need to be more, we need to get people to understand the difference, that we should align together and campaign as a community, as LGBTIQA+. But actually, we also need to talk about trans issues, non-binary issues, intersex issues, a whole range of issues independently, and actually learn about what those challenges are as well. I think finally also there is a group of people that are actively opposed to trans equality in the UK because it challenges the status quo and the power that has been built up over generations. We challenge some of the fundamental bedrocks of the patriarchy that is designed to hold people back from a whole range of different communities. And by saying that actually the gender binary doesn't exist, and that actually people can act in a different way and do identify in a way that's outside of that, scares people. And so those people with that power, because they're scared of losing their wealth and actually that generational being given things on a plate and actually power being redistributed, that actually we will rechange the way that society is structured, and our identities are a threat to that. And that's why people have come after us with such fierce ferocity and violence and aggression. So yeah, sorry I've taken so long, but that's just a quick an overall summary from my perspective on why I feel trans people face so many barriers to representation across society as a whole.
That was a very good overview. One point you brought up was obviously people see non-binary people as a threat to like society. Feel like that's the same with all civil rights that have been fought throughout time, whether that's Black Lives Matter or the suffragettes. We've been through this before, so if we keep going, we'll do this eventually.
Absolutely.
Thanel, would you like to speak on this next?
Yeah, I would definitely like to echo everything that Tara said, and has put far more eloquently, I think, than I will. I think one of the things that she hit upon is the core issue, that it is a society issue, and the way that our society has been built up has not been adequate for trans people or anyone who is remotely different. I think at the core, unfortunately, whilst things have gotten a lot better, we do still have the issue of our society is built up on the power of cis white men. So a lot of our society is still incredibly misogynistic. It's the fact that although homophobia has slowly gotten better, a lot of that still stems from misogyny in the same way that transphobia does. So our society has a strange way of punishing femininity, which finds its way into transphobia. There are many elements of transphobia that are not necessarily about being feminine, but a lot of it is this strange fear of change, and a lot of that comes from the idea that anything that is seen as feminine is seen as womanly and therefore is bad. It's the same reason that a lot of people were homophobic for so long. It's the idea that men who like men are somehow effeminate, which is related to women and therefore is bad. And we get a lot of that with transphobia, and the reason that a lot of non-binary and trans men are ignored, and why there is so much vile obsession with trans women and how problematic they apparently are, is because they're seen as effeminate and therefore weak and therefore bad. The strange thing is the whole, I'll try not to get on a weird rant and tangent about the issue of TERFs and the fact that there is this strange idea that someone not born into womanhood cannot be a woman. It's kind of very strange reverse feminism and misogyny. I'm going to try not to get distracted. Yeah, the issue is with society as a whole is still incredibly misogynistic, which breeds transphobia. And I think a lot of it has to come down to basic education and training. There is a lack of good education on gender diversity for young people and for adults alike. So schools seem to be having this weird struggle where slowly but surely there's more education on LGBTQ plus people than there has been in the past, but schools have still got the ability to keep taking it away. It's not set in stone. There is no requirement that queer people must always be taught about, and education about trans people is just not there for young people. So from the very beginning, a lot of people are still being brought into a cis-normative society. And then you get older, and then you go into the workplace, and there is no mention of trans people. So if you discover that you're trans and you go to work, you're not sure what to do about it. So if you're very lucky and you work for a place that has a policy, unfortunately, because trans people aren't especially common, I don't know how true I would say that is, but it'll be like, here's a policy. We've put a lot of thought into it. None of us are trans, but we've put a lot of thought into it, and it's really great. You read that and figure it out, and we'll just kind of hope that somehow you fix things by yourself. So I work for the civil service and am part of an LGBTQ plus support network, and they are fantastic. And they put a lot of energy into their policies and making sure that trans people read them and have input on them. But as soon as a trans person is isolated within a smaller department and doesn't have that support, they become an outlier and their needs don't become important. I think it needs to be more important for trans people to be taught about whether or not there's a trans person there. A lot of trans education support is designed around supporting the one random person who might appear, instead of this is a thing that exists and everyone needs to know about it, regardless of whether or not you know one. You don't know if you know a trans person or not. You cannot magically spot a trans person in the street. It's something you should already know about and be educated about from the beginning, as you would be educated about any gender issues in sex education as a child. It's a mandatory thing. We're not new. We've been around since the dawn of time. And I think until we're acknowledged as a very normal part of society, we're never going to have the visibility and representation that we should have, which has been shown time and time again in journalism and media, where we're still shown to be, again, an outlier, a shock value thing. No matter how many years have gone by since, for example, Thomas Beattie, the first pregnant transgender man, still a trans person will get pregnant and it's a shock. It's still this weird thing. No matter how much time goes on, we're still considered abnormal. So I will stop rambling. But yeah, I think part of the big problem is just that we're not considered a normal part of society, and until we are, things aren't going to change.
I think that kind of harkens back to my childhood as well, like not have any exposure to trans people or any gender diverse. Obviously, Section 28 played a lot of part in that, where you couldn't mention anything that was LGBT plus at all. So think things are changing where people are more aware of us, and that's definitely a positive, and probably why we are seeing more young people coming out and being themselves, which is a positive step. Jennie, have you got any thoughts on this?
I think there are a lot of different areas that one could touch on here. I'll just say, related to something that Thanel was talking about, it is, you know, the people are still treated as if they're shocking and unusual when they come out as trans. And I think there's something pivotal there, because I think that happens to people generally when they're in their teens or their very early 20s these days. And what that means is that it interrupts very often the flow of study and of getting into the workplace, and those experiences at that point in life that are really important to a successful career. And I think that does make it harder for people to get established, and has done for some years now, since people have been coming out younger. It makes social things easier, usually, because once people are out, they've dealt with all that, they can get on with their lives. But it does mean that there's that hiccup. And this is something that reflects on other communities as well. And it's certainly an issue for a lot of people in the disabled community. For instance, the fact that if something goes wrong at that point in your life, there is no route back into education that is anything like as well supported by the state as the standard route. And that's something we need to do something about. And it will help a lot of trans people and others, and a lot of intersex people as well who have trauma in childhood. Moving on from that, I would just say, when I was young, when I was in my teens, I was being nudged towards a senior political role, possibly a parliamentary role. And for me at that point, that was something I decided not to pursue, because at that stage, it was impossible to have that kind of career if you were anywhere on the LGBTQ plus spectrum. Gender was something I didn't even think of trying to talk to people about, because, you know, just not being heterosexual was enough to shock and terrify people, and there would have been no way to pursue that kind of career without a lifetime in the closet, as it looked from there. But we are starting to see progress. We do have trans people now who are city councillors. We have trans people who've been running for parliament, who've been selected, not yet in the most favourable seats, but still we've seen some progress. We've seen people chipping away at their opponents' majorities. And what I'm told by trans people who are doing that is that on the doors, they don't find very much transphobia at all. What they find is that people want to talk about the usual stuff, about local issues, and they've actually not found it much of a barrier. And the feeling is that because of this, as political parties start to understand this more, that they're not disadvantaging themselves by putting trans people or visibly intersex people forward, that this means that it will become easier for people to get into that kind of role. And I think once we have one trans or openly intersex person in Parliament, then the whole thing will change. As long as they're not a complete disaster, we should have, you know, just that visibility, that normalcy will help. Because when you see somebody in a role like that as well, you start to see them as the kind of normal person who gets into that kind of role. For MPs, seeing somebody who is trans sitting on the benches near them day to day would make an enormous difference. It would mean that they weren't thinking of trans people as the other, as this secret hidden thing. There were people who are like that person over there. And whether or not they like that person, whether or not they're part of the same political movement, they'll be a person, they'll be a human being. And what we need to achieve is getting across the message that we are human beings. And that's difficult to do when most of our visibility at the moment comes from celebrity, which, you know, isn't necessarily a bad thing. But whilst we've had more visible trans celebrities, the papers are always snipey at celebrities. You know, anything that they do wrong, anything in their private lives that looks sensational is always going to be blown up out of proportion. That happens even if they're cis. And when it's a trans person, it tends to reflect on all trans people because of the way the media will spin it. So it's not really possible to make progress from that alone. We do need people who are visible in other contexts. I'll just say also, though, on a more positive note, I wrote a book a few years ago about trans people in the workplace, and I've kept in touch with various employers' organisations since then. I speak at these things occasionally at conferences and so on. What I find is that there's actually quite a body of people out there, especially in human resources, who are really keen to bring more trans people into the workplace. And what they understand, and what I always talk to people about, is the fact that if you say, we're not going to employ this person because they're trans, perhaps you worry about what your customers will think of them or whatever, then you are cutting down on the pool of available talent that you have. You're also missing out on somebody who, frankly, if they're struggling to get work in other places and find respect, will be a really loyal employee if you treat them decently. And you're missing out on people who have experience of fighting their way through a system which often doesn't care about them, which, dealing with circumstances that are set up against them from the start. These are really good qualities to be bringing into the workplace. If somebody can deal with that, then they can stand up for your business. They can deal with issues that your other employees might be scared of and not bat an eyelid. You need this kind of talent out there. And I think it's at the moment, the struggle is about making employers more aware of this, helping them to understand that it's not just a case of ticking boxes and saying, oh, we're being diverse, we're being inclusive here and trying to look like a good guy. It's actually something that can advantage your business. It's something that's beneficial directly to you. So it's really important to get the message out there. Trans people will not damage your business. They can be an asset. It's time to start looking more widely when you're recruiting and seeing what you can do to bring people in.
Totally agree with that. Trans people are definitely an asset to anything they're part of. We fight 10 times harder than anyone else. Also, with obviously being a political party, I think parties do need to do more to bring trans people in. And all of the trans people I have talked to, which have been candidates, exactly what you said, Jenny, they haven't encountered barriers through that. Like, everyone they talk to just want to talk about local issues rather than how they identify. So I think this is somewhere which we will see progress, because most people are accepting of trans people. So we are going to get there eventually. Next, to some degree, all trans, non-binary and intersex people feel like our healthcare systems have failed them. What do you think can be done to improve our experiences and the care we receive? I would love to hear your thoughts on this first, Jenny.
Well, this is an area where it is difficult to talk about trans and intersex issues together, because there are two sets of things there. So I'll focus more on intersex issues and leave some of the other issues for the others to go into, I think. But where intersex people are concerned, we are really still very close to the starting line on this one. It is only since 2012 that doctors have been routinely telling intersex people that they have been diagnosed as intersex within the NHS. Before that, it was just not talked about. Notes were destroyed some of the time. It's very difficult for researchers going back and trying to find historical information and the kind of information you need for things like making sure that people are getting the right healthcare, finding out if particular arrangements of hormones or particular physical differences mean you shouldn't be taking a certain medicine. We can't do this research yet because of the amount of material that has been destroyed. So there's a huge amount that needs to be done. And beyond that, it's still very difficult for intersex people to feel safe, often with their doctors and going into the healthcare system about other things. This is the same for, there's an issue there for trans people as well, but it's a very specific one where intersex people are concerned, because there is very often a fear of being pushed back into a system which has been hostile from early infancy. And really the stage at which things start often being done to intersex people without consent, and sometimes things which it's difficult to put this in a way that won't potentially be triggering for people, but let's just say that it's not just what happens to people in hospitals and in medical establishments, it's what their parents are asked to do to them at home to normalize their bodies, that really, there are things you don't want to think about. In no other context would this be tolerated. And I find it very strange that we live in a country which says that female genital mutilation is absolutely unacceptable, and it's bizarre that these strange people from other countries and other backgrounds do this thing, but they do it because to them they think it will make people normal according to their culture. Well, that is exactly what our society does to intersex people, trying to make people normal, often for purely cultural reasons, and it has to stop. For the same reason, people are often left in chronic pain, they're often left infertile, they can have difficulty urinating. These issues go all the way through life. And even for people who are not the victims of unwanted surgery, there's hormone treatment very often that people are given that can drastically change their experience of life. That can cause acute depression, can cause mood swings. Women who have been on the pill will understand some of this. It's the same kind of issue, but if that's given to you and you don't have a choice about taking it, or you're an adolescent and you don't know that you can say no, you don't know how to say no, that's very, very damaging, and that's something that we really need to deal with. So as far as trans issues are concerned, I will just say that, again, last year I published a book on trans and non-binary people who are also disabled, who have chronic health problems. And something that comes up again and again there is the issue of people feeling that they can't go to their doctors, or they feel unsafe going to their doctors, or no matter that they may have had some chronic illness for years and years and years, when they go in, the doctor says to them, so how is your gender related to this? It's what we call trans broken arm syndrome. There's this idea that if you're a trans, if you're non-binary or anything kind of gender variant, then that must be related in some way to whatever has happened to you, or must be related to your treatment. And sometimes you just see, please, can we just get on with dealing with this persistent stomach bug that I have, or whatever it is? Nothing to do with gender, just needs to get sorted out. And it's particularly difficult for people who have those issues on a chronic basis, who can't avoid having to go to doctors and having to deal with the system again and again and again. But we also know that trans people have much higher rates of certain illnesses than other people because they just don't go. We're starting to see these things actually coming up in the general population now because of the extent to which people have been staying away from their doctors because of COVID-19 and wanting to avoid pressure on the NHS. Doctors tell me now, insteadly, if you're in that situation, you should go and see them anyway. They really want people to go in with other issues because they can see a backlog of cases building up otherwise. But what that means for trans people and non-binary people, people are living like that all the time. So I would say to people who are now dealing with all those little ailments and not getting the help they need because they've been afraid to go into their doctors, or they thought it's a bad idea for the meantime, to just think about what it's like to live with that all the time, because that's the trans experience. And I'll hand over to the next person.
No problem. I think we've all experienced that, where a doctor has wanted to talk about something related to our gender, and it's like, I've just got a broken arm. Can we just sort that out? And yeah, how the medical treatment treats intersex people is just awful. Just telling you how your body should be is frankly disgusting to me. But let's move on. Thanel, what are your thoughts on this?
So I suppose one of the big things I think most people can probably agree on is funding. I think we all know that a lot of core issues when it comes to like waiting lists and whatnot is funding. I think it's one of those things that I think just every trans person will understand, that you don't even need to go into a whole lot of detail about these days, which is just waiting lists are horrific. I want to say I was incredibly lucky. Not quite. So I began transition anecdote time on the NHS back when I was 17. I'm now 32. And I had to go through many, many loops. Back then, you had to apply for a lot more things. In my experience, from speaking to younger trans people, there have been great improvements when it comes to accessing medical care in the UK for trans people, in that overall, there is less gatekeeping. There is far more friendliness for non-binary people in certain clinics. You no longer have to apply to your primary care trust to request funding, to then get a diagnosis, to then get them to agree to let you go to a gender identity clinic if you're lucky. It took years. It was 10 years before the NHS would give me any kind of gender treatment, by which time most people I knew had been having NHS care for years. And there are multiple different problems with it. A lot of it comes down to, I think, a lack of education, which again, I think all education and training things can probably also come under funding. GPs need to have more information when it comes to gender diversity and their patients. They need to know where they can refer people to, what the general protocol is, and to ensure that they are actually equipped to deal with marginalized groups, including trans people, so that they avoid things like misgendering and asking inappropriate questions. Because for a lot of trans people, the very first encounter you have when you build up the bravery to try and get some care is your GP. And all it takes is a set of badly worded questions or doubt or a bad attitude. And a lot of trans people will be scared away from speaking to medical professionals for years because it damages their confidence and causes them to go backwards. And it can be atrocious for a lot of people. So for the very beginning, there needs to be more education for a lot of GPs. Some GPs are absolutely fantastic, whereas some are an absolute nightmare. And it's baffling that they can deal with any medical conditions, let alone slightly more unusual things like being transgender. Then when it goes on to actual gender clinics, again, I've had both the ups and downs of the experiences with gender identity clinics, because I've been to Charing Cross many years ago, where I spoke to a doctor who I believe is still practicing at Charing Cross, is very well known, well liked by some people. And in my experience, he told me, because I had depression and anxiety that was so severe, I could barely leave the house and I couldn't work. He told me that I was not contributing to society and therefore did not deserve hormones. I was already on hormones privately and trying to get back into the NHS after fighting for referral for years. And I said, would it be bad to, suddenly stop being on hormones because I can't afford them anymore? And he just said, it won't hurt you. So I went back to not going to gender clinics for years. And then many years later, when I finally went back and was like, okay, I think I'm ready. Can I get a referral now? And they were like, yeah, you don't have to go to your PCT or anything now. It was like, okay, we'll refer you to Charing Cross. It was like, I don't really want to go there. And it turned out there was a clinic literally a few miles from me the GPs didn't know about, because all they know is, well, London's a city, so there's a clinic there. So a lot of GPs don't even know that there is a whole list of clinics that people could be referred to. So no wonder places like London had such horrific waiting lists, because everyone is sent there. There's a lot of basic information that they don't even look up for their patients, which is really baffling. And a lot of them are quite well intentioned as well. They're ready and willing to go and say, yes, we'll get you to a clinic, we'll do what we need to do, but I'm not going to look it up. I would like you to give me the information and then I will figure it out from there. And that's a little bit worrying. You would not want to go to your GP with a severe physical condition and have them say, you look up the information and tell me about it and then I'll treat you. That's very scary. Whilst I know that being trans is not a medical condition, you're still going to medical professionals about it if that's the route that you choose to go. As I say, there are definitely improvements. Like the clinic I go to are super non-binary friendly, which shocked me because I'm old and I'm used to, like, if you're a trans woman, you have to go wearing a dress and makeup or they won't treat you. Although I did wear a shirt and it was listed as a woman's blouse in my report, which is a bit strange. It's like a binary presenting trans man at the time. I did also have to convince them that I wasn't non-binary, because then they wouldn't give me treatment because they wanted me to be non-binary. But ignoring all of those weird things, there are improvements, but there's just a lack of education still. And I think, like with a lot of things I spoke about with society, there needs to be funding to make sure that doctors are supported to know what they're doing. Things like bridging hormones are an option that hardly anyone has available, because GPs are scared to do that because they're not being supported. They don't want to give you hormones because they know that if something goes wrong, it'll come back on them. So GPs need to be supported and other options need to be available. If bridging hormones are more of a thing, that would help alleviate issues that gender identity clinics have. More need to do like what Daventry does and have GPs that handle regular appointments, not have gender specialists do everything, because then they can't handle the amount of patients they have. Yeah, I think funding. That's my final answer. My final answer is funding.
Yeah, very good point. The current system is so backlogged, it's impossible to probably ever see a gender specialist if you'll put it on the list now, which is a depressing thought at times. Tara, would you like to?
Absolutely, yeah. I'm going to take a different angle and look at, I'd like to see more trans and non-binary people working in the NHS as clinicians. and in senior roles making decisions around these areas as one of a very small number of senior trans people in the NHS. Unfortunately, we're not seeing trans people being elevated to the roles that would be making decisions around commissioning or decisions around some of the pathways that care is being decided and the allocation of resources. And I think that we need to see that commitment to trans talents into those roles, so that actually there's lived experience and voices in the room around trans issues. You hear the NHS saying that actually lived experience matters. We want to see diversity in decision making, in committees, in senior roles, and that has to follow through with trans people. And historically, there hasn't been that targeted work or that acknowledgement that's needed across the system. I think historically some of the actions have dissuaded some trans people thinking about working in the NHS. We've seen nationally the NHS working with Mumsnet, for example, around recruitment campaigns, despite people raising concerns and myself being targeted massively, and me sharing that publicly about that being targeted as a manager on that platform, and other people as well. There is some fantastic allies, though, across our senior roles. There's some fantastic chief execs and directors across the country. Sam Allen down in Sussex, my own trust where I work. Prerna, who's the new chief people officer at NHS England, is a fantastic trans ally. And so I think there is some positivity and change that we're going to see. But again, I've still heard stories of doctors qualifying after 5 years of medical school and dropping out and leaving the system because of the transphobia that they're seeing and the lack of opportunities. And I can't imagine what it would be like to go through 5 years of medical school, wanting to commit to a career, and then actually not being able to continue with that because of what you're experiencing in the workplace. And I think that we need to reflect on that as a system and do more, so that we've got that there. And I think that would help trans people feel more comfortable in care, the same way everybody wants to see people like them delivering services that they're accessing. And that goes back to the conversations we had earlier about intersectionality. Trans inclusion and trans people in those roles needs to be intersectional across disability, ethnicity, sexual orientation, etc. And that needs to be visibly and intentionally looked at. And I think we need to start being more sophisticated and professional about how we talk about broadly LGBTQIA plus issues in the NHS, and trans and non-binary and intersex issues in the NHS. Too often it's just approached in a very simplistic, generic training way. We're going to do some training on LGBT equality, and that's the solution. Again, often from a good place, well-intentioned, but awareness training is not the solution. The solution needs to be targeted to whatever the challenge is. So let me give an example. Pathology and lab testing ranges and results. We need some research and evidence base so that people can be supported in looking at what results mean from a position of knowledge. I think often when I've talked to pathology teams across the country, there's still this fear around what to do with trans people's tests, or actually maybe a simplistic analogy, well, actually, if they were assigned a particular gender at birth, that's a reference range that we should use. And actually that absolutely isn't the case, because it depends on the person's body chemistry and a whole range of things that the doctor needs to be looking at. But again, there is still a lack of research and focus on that as an area. We could look at trans people and mental health care and actually what needs to be done there. Looking at trans people and the processes around radiography. So under the ionisation radiation regulations, to be a nerd, you have to ask everybody who has the potential to be pregnant, are you pregnant, as part of going into services. Now, a lot of that traditionally has been done by saying, well, if you're registered as a woman on our system, we will ask you, are you pregnant? Has the risk that you are pregnant? And we will record that. But actually, for people that aren't registered as a woman on the system, but do have the opportunity to be pregnant, they're not being asked routinely. And for many organisations, they haven't even considered that as a particular area in risk. And they're just a handful of issues. So I could go on into every specialty in every area, but nobody is looking at it in that way. Even when you end up getting the NHS looking at LGBT issues, it's at such a top level of a sort of big brush approach to, we need to talk about LGBT. And then when you ask for trans issues to be separated, you're almost accused of, well, now you're separating trans away from LGBT, and isn't it that we group them together? And it's like, no, that's campaigning together. That's about solidarity, but it's understanding, just as Jennie was talking about in terms of intersex issues, there being particular issues and training and focus that we need to be looking at. The same when it comes to trans issues compared to sexual orientation and sexuality. And I don't think the NHS has got to grips to that. And I think that's something that we need to be looking at. I think there does need to be a big focus on primary care, because I think a lot of care is around primary care, and many of us are scared, and I'm going to use that word, of going to their GP. I am probably quite a gobby person for anybody that knows me. I've done TV and radio over the years with some quite difficult commentators. I tweet, I come onto events like this, and I work in the NHS. And you have to drag me to go to my GP because I'm just tired of the questions that they ask you, the barriers that get put up to access just the basic care. And I know that's a risk to my health. I know that actually there's a chance that later in life, I'm not going to get the treatment that I need early enough for something not related to being trans, but just because of my experiences in accessing healthcare. And I'm relatively privileged as a white middle-class trans person working in the NHS. And so actually, if I'm facing those barriers, the barriers that other people are facing are much greater, and we need to acknowledge and accept them. And it needs to be more than pride, more than rainbows. We need to look at trans and LGBT issues broadly in a sophisticated, professional way, the same way we look at infection control, the same way we look at safeguarding, the same way we look at any other area that gets a focus and resources in the NHS. My fear is that lived experience is where the narrative is sticking at. And actually, lived experience is absolutely essential and needed, but that needs to come with expertise alongside that, and a focus on, just because I'm trans doesn't mean that I have the solutions to every single issue that exists across the system. And just because you've talked to one trans person and involved them doesn't mean that there isn't barriers that you still got there within the system. So I think that my message would be that we need to look not just at specialist access to trans care that we've talked about. That's a key issue that we do talk about. There needs to be funding. Trans people need to be able to access specialist care that allows them to make choices about their transition and their life. But we need to spend enough time as well looking at access to cancer care, to wider health conditions that often doesn't get that focus and discussion.
Yeah, totally agree with that. The hurdles for any trans person to access any kind of care in the NHS without being misgendered or any other of the issues we face is definitely difficult. So for the next 20 minutes or so, we'll take a few questions from the chat. If you have any questions for anyone, you can put it in the chat box and it will be fed back to me. So kind of alluded to this a little, Tara. The question is about having kind of the LGBT umbrella and having sexuality and gender rights being fight alongside each other. So should we be, the question is, should we be fighting for these issues together, because it may be confusing for cis-het people, for example?
Is that a question to me?
Yeah, if I can ask you that first.
Yeah, absolutely. I think that there is strength in solidarity across every issue. I think that we should all be campaigning for civil rights across all communities as a starting point. I know that I try and make sure that I'm campaigning on a breadth of issues, not just issues that affect me. I think that within the umbrella that we discussed, that actually campaigning collectively gives us strength. It recognises that, as we've heard already, a lot of the discrimination and barriers and hate that we face are cross-sectional. People actually are built, transphobia is built off homophobia, that's built off sexism within society. And so actually it's important that we do align together and work on those collective issues. But when it comes to learning and understanding experiences, the same way it's important that we have spaces for people that have different lived experience because they may have a disability, they may be Black, they may be Asian, they may actually have a different faith belief, a different religion. They may have different life experiences. We need to give spaces for that difference within our communities. We also need to recognise the differences that trans people experience, and the barriers in healthcare around gender are different to the barriers around sexuality. So if I'm going to do a training session on a particular issue, there's nothing wrong, and actually we should be looking at training on trans people and non-binary people within different care settings, and looking at sexuality and the barriers that are around sexuality differently. I'd also like people to recognise that trans people have a sexuality too. I'm tired of everybody talking to me on LGBT issues in the NHS. I'm often dragged into rooms with chief execs and directors to senior tables because there's very few trans people in senior roles, but everyone's much more senior who are lesbian or gay. And I'm often one of the few people who's also bisexual. But because I'm trans, that bisexuality becomes something that isn't really discussed or viewed. So I think an acknowledgement that trans people have a sexuality too, a sexual orientation that's there that to discuss would be interesting too. I hope that sort of answers the question.
Yep, that definitely does. I'm pansexual myself, so I definitely feel in that kind of erasure of that part of my identity. Like, I'm always the trans person, I'm never the pansexual person, kind of thing. So next, did anyone else want to take a stab at that question, or should we move on?
I'd like to just say briefly that this is complicated sometimes where intersex people are concerned, partly because the number of intersex people, at least people who are able to talk about who they are openly, is so small, even compared to the number of trans people, that when people say they'll include intersex, often it really is just a bit of, its own form of pinkwashing. It doesn't mean that any action is taken to help us, and yet it could consume funds that would come our way otherwise. So that's problematic. The other big issue where intersex people are concerned is that associating intersex people with LGBT people more widely is a factor which can put intersex people in danger in some parts of the world. And so we need to be careful about how we're campaigning, where we link these things together. It's not that we should at any point settle for other people being in danger because of who they are, but intersex people face particular risks because there is a high rate of infanticide. For instance, a child will come out visibly intersex and be killed within a couple of days, and there is no time to try and do anything about that. So it's a different situation from people being LGBT, and we need to acknowledge that in how we campaign and where.
Thanks a lot for that, Jenny. That's a valuable insight. We definitely don't hear enough intersex voices in kind of the community as a whole. So it's definitely valuable to have your time here. So next, just have a clarification. Someone's asking what was the medical staff putting down to being trans called again, because they didn't hear it properly.
Trans broken arm syndrome.
Do they want to talk a bit about on that as well?
I can give a little bit of anecdotal evidence of how right that is. Back when I was a bit younger and hadn't gone on hormone replacement treatment yet, so pre-testosterone, I had a lot of trigger warning, I'm going to be using the term gynecological issues. I had a lot of gynecological issues, and every single time that I saw any specialist, of which I had to see many, immediately the question was, so are you on testosterone? No, you've got my notes, I'm not. Are you on it unofficially? And I would get repeated questions of, have you been on the internet and ordered some drugs? Like, no, I wish I could use that as a reason, but unfortunately, no. And yet, 9 times out of 10, actually pretty much every single time I see a GP, and I know many of us have experienced this immediately, so how are things going at the gender clinic? I don't know. I see them like twice a year. I'm sure they're all fine. I don't know.
Yeah, I'm sure we all have stories a bit like that. So next we have so a question about kind of press. How do we counter the negative press around trans and non-binary people?
I guess this will be one for me, given my work with Transmedia Watch.
Yeah, that would be a valuable insight.
Complicated issue. We do a lot of work, for instance, with local press, and we find that we get a lot of support there, and people are interested in trans issues in a very sort of practical, helpful way. As Tara was referring to, having been invited in to talk to local press quite often about these things. It is a different issue when it comes to the mainstream print press in this country, because it's owned by 5 people. Pretty much the whole of the national print press is owned by 5 people. And that means that they set their agendas, and there is very little we can do about that. Now, one of those 5 people, Paul Dacre, who owns some prominent newspapers in this country, has, I'm told, very personal, strong feelings that being anywhere on the LGBTQ spectrum is wrong morally, and he will always stand against it. And there are people at his papers who do not agree with this. Put it this way, they are not able to speak out publicly about this because they're worried about their jobs. They try to print nice stories when they can get away with it, but when they feel leaned on, there is this agenda that they're supposed to follow, which is anti-LGBT generally, and more specifically anti-trans, because that's easy to do at the moment in the current climate. People who feel that they can't be openly hostile to lesbian, gay and bisexual people in their writing, or even in their television items, will be hostile to trans people. And it's kind of a shortcut, and it's one of the reasons that we say, look, when you see these things happening to trans people, beware, because they will happen to trans people first, then they'll happen to lesbian, gay and bisexual people, as we've seen indeed with newspapers last weekend. A piece from an author who likes to write about trans people in a hostile way, now questioning any kind of LGBT education. We also then tend to see that these things from the same people, they'll move on to attacking women's rights. We've seen that recently in Poland, for instance, so we need to be very careful about it. It's a bigger issue than just what happens to trans people, and people need to understand that, allying with us is not just about being helpful and nice, it's about protecting yourself in a lot of cases. We work with people who are positive and enthusiastic about trans rights where we can, and try to get people more involved in that. Intersex is slightly different. It's really, really hard to get people to cover intersex issues, except around occasions like Intersex Awareness Day, when suddenly everybody wants to write about them, and they all produce really similar looking articles. And they're generally very positive and helpful, but then that just disappears the rest of the time. The main thing people want to write about where that's concerned is sport and the awful things that are happening to Caster Semenya now, but there's very, very little understanding about that. I worked with one BBC producer and talked to him about it, and we had a very productive discussion, I thought. And then at the end of it, he said, but what if Caster is a man? And I'm like, has this completely gone in one ear and out the other? This entire discussion, because it's missing the point when you say, does this person fit into one of these 2 brackets, that obviously they don't, or there wouldn't be an issue in the first place. Yes, where trans coverage is concerned, we do have supporters. We do have people who are trying to get it right. Transmedia Watch has famously worked a lot with Channel 4. We're not happy with all of the programming on this, as I think people know. But Channel 4 News, for instance, has been working hard to not only bring in trans people to speak on a range of different issues, but to find people who are trans and also part of other minority groups. So we get people of colour who are trans, we get disabled people who are trans, people who wouldn't have that opportunity to speak otherwise, because if you're in more than one group, as we know, it's especially hard to get any visibility. So there are people helping. And I think we have to be a bit cautious. We know that hostile media does a lot of damage, but we also find that a lot of trans people feel that all the media is against them and there is no hope. And that's not the case. In some cases, when certain elderly white newspaper owners die, we will see things change, I think, quite dramatically. And it's just a case of waiting for that one. In other cases, we've found that hostility to trans people actually seems now to be damaging circulation. So we will hope that in the long term, as public ideas about us change, it will become less possible to be that hostile. At the moment, our thinking is rather that some of the people attacking trans rights have overreached themselves and been so nasty and so repeatedly hostile that it's starting to become visible to people who are not trans themselves that there is an agenda here, and this isn't just about raising genuine concerns, as they like to phrase it, that there is repeated hostility across the board on all kinds of different trans issues. We are hoping that this will consequently swing back in the other direction. We have a lot of support from other countries where that has happened. You talk to journalists in the States and they think, what is going on here? They can't understand it. They see trans equality as a feminist issue and they say, why is that not understood here? There are certain, again, this is difficult to go into without naming names, but there are certain groups of people closely associated with one another in the media, editors, people in specific niches within broadcast, people, for instance, working on news and current affairs at the BBC have been particularly problematic recently, and they all tend to know each other. And if you do a little bit of research, you can see how many of them are actually married to each other, or inhabiting very closely the same social circles. And so I think that once these little groups are dispersed, eventually we will see things change. It is a case of working to try and bring up other people through the system. In the BBC, for instance, there is a women's group which has been taken over by people who are hostile to trans rights. And I've talked to a lot of people who said that they've left that group because they find people in there so toxic and so hostile all the time, and they're so nasty about trans people, so they don't want to be a part of it. And we're saying, please go back, be a part of it. The problem is, and this is, someone said to me, this is classic Marxist takeover tactics. People come into a group, they're very persistent with their agenda, they're aggressive to people who don't share that agenda. The nice people leave, and then there is nobody left to argue for, for equality, to be moderate and inclusive. And we need women to take back those spaces, to take back those groups within the media, especially, so that we can change things. I hope there wasn't too much all at once. I could talk about this all day.
No, that was fantastic, Jenny. Kind of having your background is really helpful with Transmedia Watch. So next, quite a good question. I think this probably is for Tara. If setting up a staff support network at work, what would be the most important elements be?
I think the first thing is to think about what do you want the network to achieve. So actually having some goals for why you're setting it up. So don't just set a network up for the sake of setting a network up. So actually think about really what is that network there to do. I think secondly is make sure that you try to involve as diverse a group of people as possible and being really intentional about that diversity and that intersectionality, because I think particularly when it comes to LGBT plus staff networks, there's too many networks which don't reflect that broad intersectionality of our communities. And again, they're often from a really good place, but actually they can become excluding by their presence if they haven't got that intersectionality built in from the beginning. I think thirdly, it's about thinking about where do you sit in the organisation? Is there a route for people to hear you? Have you got the voice of a particular director or leader? Are they looking to include you in their structures of the organisation? Or are you there just as a support group and actually there to provide peer-to support to colleagues? Both can be really useful. As I said, the trans staff network that exists outside of organisations as a group of trans peers, we don't have chairs or positions. We're literally a peer-to-peer group to help each other and provide support and advice. And that can be a really useful role that's often not discussed. But equally inside organisations, it can be really useful to have representation on committees that exist. So I think that's really important, thinking about where you sit within the organisation. I think making sure the organisation, if they want to take credit for your existence, that resources what you're doing. So if the organisation wants to say it's great, we've got an LGBT staff network, well, actually they need to support that by either providing release time or resourcing. So put a practical case around what you think that could look like. Be realistic. Actually talk about how that could work and how it would add value to the organisation that you're working in. Don't just say we want this, but actually talk about why that could have a positive impact for whatever organisation that's in. Give examples of where things work elsewhere. So I'd say really do link up to networks that are already in place. Speak to other staff network chairs. If they've got a business case paper, for example, use somebody else's. I think at university you're taught that copying is cheating and plagiarism, and in the workplace you're told that it's research and actually what you should do. And I think it's the same when it comes to staff networks. You're not starting something that nobody has done before, so actually don't sit there in a room thinking that you have to come up with all the solutions. There's people that have already got solutions to many of your problems, and most of all, have fun. Because the minute that actually you don't have fun with people, you're going to be putting in extra hours and doing extra work, because that's often what staff networks will do. And if it isn't fun and you haven't got those relationships with friends and colleagues that you're doing with, you won't be willing to put in that time. So make sure there's a fun element to anything that you're doing.
Yeah, that's a valuable insight, and definitely learning from what other people have done is very valuable in kind of setting things up, especially in the workplace. Jennie or Thanel, would you like to say anything on this as well?
I can mostly just agree 100% on the committee of a staff support network. All amazing points. I think the intersectionality one is a good one that people forget quite a bit. You will benefit a lot from reaching out to other groups and trying to collaborate with them, because it's so easy to get swept up in, we've got a specific group for specific issues, that's great, and forget about all the rest, when actually a lot of the time you can achieve bigger goals if you work together, and also borrow resources and make bigger events instead of trying to do everything yourself. Yeah.
Okay, so just a final quick question. We'll start wrapping up now. So it's a hard time out there for all of us. What words of encouragement would you give to all the trans, non-binary, intersex people who are watching? Sorry, I forgot to ask someone the question. Embarrassing moment. Jennie, would you like to go first?
I would just say that it's very, very difficult when you're looking at your own immediate situation, particularly if you're experiencing harassment or you're experiencing intense dysphoria and you need things to change right now. But if you are able to step outside of that even a bit, then we know that these things change over time. We've seen the way, for instance, that the media has changed and that culture has followed suit in the UK around a lot of issues where, on race issues, on LGBT issues, things are by no means perfect. There are a lot of difficulties out there, but it is a lot better than it was. Women's rights have advanced tremendously from where they used to be, even though there are still massive problems with misogyny, and trans rights will advance as well. Intersex rights are already making big progress. I mean, things, as I was speaking about earlier, it's shocking how long it took for certain things to happen, but we are able to start discussing intersex issues now in a way that's starting to involve the medical establishment, and things are starting to make progress. So there will be change, and what I would advise people to do if they're feeling down is to look for ways that they can be part of that change. There are lots of small things you can do. You don't necessarily need to be on the front lines if you're worried about having to deal with hostility online or that kind of thing. There are lots of little ways you can get involved with many different organizations out there to help to bring about change. And when you know that you're doing something, when you know that you're helping to turn the tide, then it's a whole lot easier to cope with what's happening to you in the meantime.
Thank you for that. Thanel?
I would say the main thing is that you're allowed to feel things. You're allowed to be angry and upset and disappointed. If something doesn't go your way, it's okay to take a moment and feel all of those negative feelings. There is a big drive for positivity, which is incredibly important, but don't hold it back. When you're part of a marginalized group, it's very easy to get overflooded with the negativity and think, I have to be strong, I have to hold together, I have to power through, or just be angry and aim for rights and everything's fine. But it's okay to take a quiet moment and think about yourself and what you're going through. we're not all two-dimensional people where being trans is the only thing we have to think about. There are going to be other elements in your life that are impacting the way you feel when something big happens to do with trans people. So it's okay to take a moment to mourn or feel bad. And once you've done that, then you can work on actually self-caring. I think positivity can only come once you've given yourself a chance to feel bad. It's not necessarily a bad thing. People need to take a moment to take care of themselves. There are always going to be people out there who are going to keep doing the fight, even if you can't for a moment, and you shouldn't feel bad if you can't do everything. Not everyone can go out and protest. Not everyone can get the opportunity to do something like this and speak for people. For trans people, this is a sentence I've used far too much recently, but it always rings true. Just stepping out of your front door is a protest. Your existence is important alone by itself. Everything you do is important because you've embraced part of what you are in a world that isn't necessarily entirely equipped for that yet. So everything you're doing is already good, so never feel like you're not doing enough. People like me and just hundreds of hardworking people will keep doing the fight, and you can join in when you're ready. There is no rush. Take care of yourself first and foremost.
Thank you, Dorian, Thanel, and Tara.
Yeah, I'd say firstly to not feel guilty for not being connected and logged into everything all the time. Even those of us that have jobs working in equality and diversity actually have to log off from the level of hate and negativity that we sometimes see, or just the amount of content, whether it's negative or not. And I know that I sometimes feel guilty just not reading an article that everybody else seems to have read, or not watching a TV show about trans people that people go, have you seen that TV show? And actually, I think as human beings that we can't be connected all the time. And actually, it's healthy not to be connected all the time as well. So look at that opportunity to not be connected and try not to feel guilty if you can about that, because that's really healthy for your well-being. Know who your support networks are. Have those people around you that a strong positive influence in your life, not necessarily just about being trans, but they're the people that are there for you. I'm a strong believer that you get to choose your family in life, and the people that you get to choose should be your family, the people that are important to you, around you, in whatever capacity those people are. And maybe that's because I'm adopted and so I see the world in a particular lens, but identify who those people are and make sure that you're there for each other and you've got that mutual support on everything, whether it's trans rights or just the way that the world is at the moment with COVID-19 and obviously everything else that's going on, because the world has some negativity across a whole variety of areas, not just trans issues that we're talking about today. Know that there's allies out there that are standing up for you and do support you, even people in roles that we might not think about. Like I've said already, there is some absolutely fantastic trans allies in the NHS in senior, very, very senior roles. Like I said, our chief people officer at NHS England is an amazing trans ally. Some of our chief executives are fantastic trans allies in NHS trusts. And you might not have seen or heard or know that those people are there. So actually knowing that you've got those people trying to fight and push our corners, I know has a positive impact on my well-being. And I've made a commitment to try and amplify awareness that those people are there, so that can have an impact and a positive place for other people. But also finding opportunities for happiness in your life in different places, in small places, and in times where you can find those moments where you're happy. I know recently I've taken up hiking and going up tops of mountains and finding happiness in beautiful views with my partner in moments of silence and different spaces. And if you told people a few years ago that I was going to do outdoorsy stuff, they'd have probably laughed at you. Like I said, I eat cake. But seeing a beautiful view with somebody you love actually really helps put the world into perspective and re-energize me to go back to taking on some of the inequalities that we see in our society around you. So finding those moments of sparkles and energy and positivity, if you can too, I think is really important in life.
Thank you very much for that. So I'll just say, you're all beautiful, you're all wonderful people, and you can do anything. Just build that supportive people around you and you can do anything. So I am just going to thank our audience for watching in today. It's a pleasure to have all of you. And obviously to our speakers, Jennie, Tara and Thanel, it's been all brilliant to talk to you tonight. So thank you all, and we'll close it there.
Thank you.
Thank you.
Thanks.